Welcome, everybody. I'm delighted today to present this Dairy Heifer Calf Association chat. My name is Gustavo Pena. I'm one of the technical veterinarians for Zoetis in the Midwest. And let me start telling you about this constant reminder when I introduce to the farms, we do not have Mycoplasma. Today is my pleasure to work with Dr. Rodriguez, which is one of the technical service veterinarians in covering Arizona, Colorado, and Michigan. Dr. Rodriguez is originally from Venezuela, where he pursued his veterinarian school and he did an MBA. Dr. Rodriguez is being essential implementing calf treatments and calf protocols in several dairies and calf ranches in all the US and some international work that he does. It's a pleasure to me to work with him. He resides in Arizona with his family and he's happy enjoying do outdoor activities in Arizona. Before I handle the microphone to him, let me take care of some house items. First one is this same chat is going to be presented in Spanish on October 16, 12 p.m. Central Time. If you have any question or comments, please use the comment box. I will be reading and monitoring that and asking those questions to Dr. Rodriguez. Dr. Rodriguez, it's my pleasure to introduce you and to give you the.
Thank you, Dr. Pena, and thank you everybody who is joining right now. One reminder, hey, this is a casual chat, okay? This is not a formal webinar. So I encourage you guys to you ask questions, to give comment. No? This is a topic that really is exciting to me. I like mycoplasma. Since we started talking about mycoplasma and with the introduction of the new live vaccine, it has been a great journey for me. So I hope that you enjoyed that. We're going to make some pause during the presentation and please bring your comments and your experience. So a couple of key messages that I want to leave here, okay? Mycoplasma is a silent disease, right? It's relatively new disease and it's recognized with increased frequency as a cause of disease in cattle, mostly in the calf. Okay. Now, I always say that one of the most underestimated part of the mycoplasma is the subclinical part of it. Okay. Many people just look at the calf, look at the health, some respiratory problems, and they don't really think at first about mycoplasma. And when the disease progresses, they go around and you start having some clinical signs, clinical problems. It might be already a couple of months or maybe more, and the people has not really thought about mycoplasma. That has been my experience in the field. Okay. The second message that I want to leave is that if you want to control mycoplasma, you need to have a comprehensive approach in how to control this disease. If you believe, for example, that I'm just going to add a vaccine, like a live vaccine, and I'm going to control mycoplasma, that is not true. You need to create real expectation in how to manage your operation. Colostrum, maternity, nutrition, cleanliness, ventilation, and all these details on management that are key. Again, this I'm going to give a couple of experience on the live vaccine and the result that we have seen, but this is just part of the puzzle that we have right now to control mycoplasma. Okay, so most of the people, beside the adult cows mastitis for mycoplasma, they can see respiratory disease, right? But if you see a calf like that, people say, okay, that's might be having some pneumonia. People think for manhemia, it might be salmonella, it might be, BRSB. And at the end of that chain is when the people think about mycoplasma. And that's what I want to, give you awareness, okay? Be careful because mycoplasma is more prevalent than a lot of people credit for. Okay. Eh, you also can have some ear infections, and I'm gonna tell you about an experience of a dairy who was having ear infection, but they were not having much of respiratory problems. So if you see a small calf can have that, sign, moving the ears, head tilt, and that's something that you can see sometimes as a very subtle sign. Okay. And one of the a lot of people have recognized is the joint infection. Okay. So joint infection sometimes can be very secondary. Okay. People relate that with the problem on navel dips. Okay, but basically mycoplasma can come and go through the blood and colonize, right? The joint. This particular sign, the people say, hey, we don't have a lot of treatment success when we have that. And it's pretty common to hear that. Okay. So all those signs can be together or by itself. And that's when I want to give you some tips on right now. Okay. One slide about the pathophysiology. Usually, right, the animals are infected through the milk, right? Contaminated milk or colostrum, okay? The oral ingestion have been proven. It can colonize the palatine and pharyngeal tonsils. There are some research that also through nebulization, the animal has been infected with mycoplasma. This bacteria is amazing. If somebody is interested in looking a little bit more about the pathophysiology or even the immunology of that mycoplasma, reach out to me. I have a couple of research that I really like and enjoy if you are into the immunology. Okay. I am not an immunology expert. I'm an immunology enthusiast. I guess that I heard that term one time. Okay. A lot of people ask about the colostrum. Colostrum has not a lot of benefits when we have seen the research. So this is a bug that actually dances and hides from the immune system and can create a lot of problem into that. Okay, so let's go a little bit on the practical in cases that we have seen, and I have some information from Dr. Geoff Smith that shared with me some cases that I wanna give it to you. Okay. So look at this case. It was a dairy in North Carolina. They were having a lot of otitis cases, but not that much respiratory problem, not that much pneumonia. The animal, the dairy was basically treating from tulathromycin to tetracycline. They start looking that the treatments were not being success, and they were having a little more of respiratory cases. But they say, hey, we don't have mycoplasma. We don't have mycoplasma in the milk. We haven't isolated anything. We're doing good in maternity. We're doing good in the colostrum. That we're feeding a good quality colostrum. Um, we have a pretty decent management on the calf. We start those calf, young, and then we go to a greenhouse, and we feed pretty well. We feed meal replacers, so there's no way that we can have mycoplasma here. Okay, so one picture about the maternity, so you can see very decent maternity, nice facility. uh, this is the barns where the calf were going over there. You can see some of them pretty clean. The bottles they were taking care of a lot of the management stuff, trying to keep it dry, good ventilation. And they were saying basically, we don't have mycoplasma. There is no many signs of mycoplasma. Those otitis might be due to something else. Okay, so here's when they decided to look at some of the information, right? They decided to do a necropsy. They have 7 calves that were 6 of them with chronic otitis cases, but they didn't see much pneumonia on them, and that's what they were trying to find out. What is this otitis? What is the cause of this? We don't have, much pneumonia, but they did have a chronic calf that they decided to also euthanize. Okay, so out of those six calves that have otitis, all of them grew mycoplasma on culture. Okay, Some of them, they have been treated with oxytetracycline, but 4 of those otitis gel have also pneumonia that they didn't see. They didn't show clinical cases. And that is something that I'm going to repeat every single time. Be careful of the subclinical part of the mycoplasma. It can decrease the immunity of the animals. It can work without giving clinical signs, and you can have that problem. Okay, I had the opportunity to visit a feedlot 2 weeks ago, and the guys over there told me, hey, we don't see a lot of problem. This animal that you are doing the necropsy right now, I saw it yesterday. No problem on that. And when I opened, the pneumonia, I mean, the lungs were all basically, compromised. Okay?
Dr. Rodriguez,
Yes, sir.
because this is an interactive chat, I have a
Sure.
couple questions in the comments. So the first question is, there are certain operations more prone to Mycoplasma bovis than others.
Yes, I will say if you have an operation that you are collecting the calf from different sites. So, for example, I have an operation in Arizona that we work on mycoplasma control. They receive the calf from 5 different sites. That's a high risk over there. Okay, I would say, if you are a calf ranch that are bringing from multiple and you're raising those calves that sometimes you don't even know how the colostrum quality or the intake of the colostrum or the total seroprotein, that's another one that I will flag, right? Those are um, facilities that may have some problems. Also, if you have an operation that the ventilation is not good, the flushing or the way that you're cleaning might have some, opportunities over there. That's another one that I will pay attention. Okay.
Okay, I don't know if you're going to address this question later or you can address it today. Uh, just remind to the people in the audience, if you have a comment or question, please use the chat. So I will refer those questions to Dr. Rodriguez. But the question is, because we have veterinarians, we have calf care people here, and we have managers of those operations.
Sure.
Um, what is or why is my treatments failing? What is the problem with these bacteria that my treatments are failing?
Yes. So the way that the mycoplasma is able to evade the immune system is very interesting, right? Mycoplasma can be intracellular, and where there is intracellular, it can go everywhere. It can go through the white cells around, and that is a way that they protect themselves, right? In certain mode. Okay. Also, they have mycoplasma has different immunogenic way to work. Okay, and not all antibiotics work, right? So everybody talk about, okay, they don't have cell wall, and that is why, for example, safety penicillin don't work on that, right? So the target for those antibiotics is not there. Okay, so another problem is that sometimes mycoplasma is able to manipulate the immune system and make the immune system make some cells, for example, neutrophils, that are not really efficient in controlling mycoplasma. You would like an early response, mostly with macrophages and T cells, and for a different, again, immunological way that he does. Okay, mycoplasma is able to manipulate the immune system. And what we are seeing in the research is, for example, if the neutrophils or the humoral response is basically the main response, mycoplasma can benefit on that, that integration on that uh, accumulation of neutrophil can be actually very good for mycoplasma. Okay, so it is a really interesting, difficult box to have, right? A lot of people talk about resistance. It's difficult until now. Actually, a week ago, I know that one of the diagnostic lab in Iowa is trying to do some susceptibility for mycoplasma, antibiotic susceptibility. That will be interesting to see how develop that particular test. I really like it. when I read the first stuff. But yeah, Mycoplasma can also be resistant to many antibiotics, right? And that's the situation. So it evades the immune system. It creates an immune response that is benefit there. It can be intracellular. Some antibiotics don't go into the target, and also it has some resistance to some of them. Okay. And another stuff, right? If the mycoplasma goes, for example, to the joints or different sites, those are sites where mycoplasma is protected as well. Okay. Anything else?
We have another question, but I think you're going to address this one in a couple of slides.
Okay, let me go for this and I will stop in 4 or 5 slides. Okay, so anyway, a picture. Everybody likes a picture. Look at the amount of pus over there, right, in the Palatine area. That's interesting. This is a picture from Dr. Geoff Smith that he gave to me. Interesting one. And this is kind of the lungs that you can see sometimes in mycoplasma. Again, one of my experience, sometimes I see animals that they didn't show many clinical signs, and then you see some very compromised lungs. Okay, and you can see animals as young as 10, 12 days, sometimes with a lot of problems in the lungs like that. Okay, so that's when the mycoplasma is a big problem in clinical cases, and well, that's when you are in a big trouble also. Okay, so 2 slides. So where was that mycoplasma in that particular case that I just told you was coming from? From the colostrum? It could be, but every single cow was cultured for mycoplasma and they didn't have a positive animal in 5 years. Okay? The maternity pain, probably, right? But it was a good, well-managed maternity pain. It could be a possibility. Milk, they didn't have milk from the tank. It was always milk replacer. Water is possible. They run chlorine dioxide in the water, cleans the line. So they had a good management on that. Okay. Calf to calf contact. Yes. Okay. The animals were all in, all out, and the cultures were negative, but it should not be cycling there. But the mycoplasma was there. Okay, nasal or vaginal flora of the cow. It could be. There have been some research who have shown cows that can be have been carrying mycoplasma from their entire life. Okay, I'm just gonna put this one if you want to see that research. I'm not gonna describe every single one, but it was a research done multiple years, basically looking at the cat that had that situation when they were contaminated through different stages of their life. And this basically study gave the possibility that the mycoplasma was around with in the cow herds, circulating with them, and the cows can be transmitting the bacteria at birth, okay, and getting those animals already, with mycoplasma at day one. And well, it's interesting the way that this particular bug was going through the cows through their life. Okay. So I don't have mycoplasma. Gustavo, I can pause here if there is a question.
Yes, we have two questions here are kind of similar. The first one is, there is a time in the calf days of life that the mycoplasma bug is more prone. And kind of the same topic, it's a second question, if there is any age or any pens in particular that we can watch mycoplasma more closely.
Well, I have seen a couple of pain points around. If you have an endemic problem, if you had some mycoplasma in the middle of the colostrum, I have seen early animals having that mycoplasma. Okay, so be careful if you start seeing animals that you see immunosuppressed or getting weak or thin the first 2 weeks of life. I have seen that. Now, if you're gonna ask me, hey, where is the main point in the calf barn? Usually around 35, 45 days. And the big problem that we have seen is at the weaning pen. Okay, I'm gonna show you on a slide later about a study that we did in a big calf ranch, and the most impact that we saw on the strategy of the vaccination with the live vaccine was in the weaning pen. So those are the three main points that I will say. Be careful if you have mycoplasma endemic and you're contaminating the calf early, around the first 2 weeks of age. Then you will have a peak around 35, 45 days. and then at the winning pens. Usually, the people move those animals at 70 days. So around 80 to 90 days, I've seen a lot of peak of pneumonia and a lot of mycoplasma there. Yeah.
Dr. Rodriguez, I just want to reiterate in the early question. So I do not have Mycoplasma bovis. I've been sampled the colostrum. I sampled the milk. I sampled couple calves, and I do necropsis, and I don't find any Mycoplasma. And you relate early that there is two causes. Could be chronic, and that's when we see those lesions on the lungs, but also could be subclinical. And if the death is instantaneous, then we will not have those lesions on the lungs or in the nasal passage as you show early in those pictures.
Yeah. Yeah. And I'll talk a little bit about that. Let me go and I'll talk a little
Okay.
bit of that
Okay.
particular.
I don't have Mycoplasma bovis.
I don't have Mycoplasma bovis. This is probably the most common feedback that we hear in the field. Hey, we don't have Mycoplasma. We never culture Mycoplasma in the tank. I don't have cows with mastitis for Mycoplasma. I don't see droopy ears, swollen joints. I give milk replacer. I don't have waste milk or milk from the tank. So just remember, this bug can be always be present, okay? And it shows during stress. Again, this is probably the third time that I say, don't underestimate the subclinical part of the mycoplasma. It can work its way, it can decrease the immunity of the animal and actually give that path to the rest of the pathogen. And mycoplasma is just setting the stage for them, okay? And when the times come, the stress is there, the mycoplasma start creating clinical problems. Okay, remember, those bugs don't work by itself; they work all together. That is why it's called, the BRD complex, right? So here we go on this. Remember, you might see forecalf and you might not see a lot of signs around. You might see probably here and there one of the joints problems, but be careful again with the subclinical part of the mycoplasma. Let me give you this example, and then we stop again for question or for chat. So this is a cat rank that received, from different sources. They were having the major problem post-weaning. Okay, pre-weaning they didn't have that much problem. Hey, we don't have evidence of mycoplasma in the young calf. We don't see head tilts. We don't hit droopy eyes. Not much pneumonia. Our problem is Salmonella Dublin. Okay, the Salmonella Dublin was the problem over there. This is kind of the facility. And then one time they say, hey, let's pick a calf and let's see what is going on, because we need to find out. And that's a great tool, the transtracheal watch, to see what is going on in the lower respiratory part, right? So all of them had signs of respiratory disease, but had not been treated. Okay. The dairy used to say, hey, we have salmonella. That might be showing salmonella over there, but let's find that out. Okay. None of them were positive for salmonella. A couple of them for pastorella. Yeah, pastorella is always around, right? That's expected that pastorella should be around there. It's very common. But here is the mycoplasma culture. Um, Out of all those animals, 5 of them they have a positive for mycoplasma. And again, the people at the dairy, the consultant, they say there is no mycoplasma, there is no sign, there is no not way that it could be the mycoplasma over there. Okay, so another case, dairy in Georgia. Okay, they have some Barnes group and 50 calf. They give, metaphylaxis or antibiotic for control when they move the animal from the hutches to the weaning pen. Okay, and the mortality has been 9%, in that time of 2022. And this is an experience from Dr. Geoff Smith, also from Georgia, and they decided to put different management practice in place. But this is when they were having some problem. You see those animals that sometimes they don't look that good in body condition. You may see one of them, that they need to pick up around. You see some signs, and I don't know if you can hear the sound too much, but basically a lot of coughing. in general, the animals didn't look that healthy. A couple of sneezing here and there, neck extended. Okay, so they decided to implement different management situations. I will talk about management for the program later, but this is an experience that they have with the live vaccine. Okay, with productivity, they started in summer 2023, and they were able to decrease the mortality on that. Again, do not think that just adding a vaccine is gonna bring all your problems down. It's gonna solve all your problems. Okay, the results might vary. It might be you need to do a entire program for you dairy depending on the factor and the condition that you have. Again, working nutrition, working colostrum, working ventilation, cleanliness, the people is important, diagnosis, antibiotic, and of course, in my experience, since we launched this vaccine, this is part of the solution, and I think it's a great tool to help us in controlling the mycoplasma. Okay, so this is again no head to head. This is the same pen, different animals, of course. A year after, um, animals look a little bit less, condensed than in the other picture, of course. But you see, they look also like a better body condition, better health. And that is something that we have seen in time when we implement the program and then we implement the live vaccine. Give it time to that program to work. Set real expectation. If you believe that you're going to control a problem with mycoplasma in 1, 2, 3 months, I'm sorry, you are wrong. The control of the mycoplasma problem in a dairy, in a facility, takes time. In a dairy facility, takes time. I actually helped a couple of dairies that they were having endemic mycoplasma problem, and I implemented different strategies, and one of them was the live vaccine. And I saw how, in time they were getting better and better. But sometimes, depending on the situation, it might be 6 months, 1 year. This box is different. Okay, this mycoplasma is a totally different case. Okay, so anyway, mycoplasma is more prevalent than what the people think. Okay, we don't really know a lot about the mycoplasma transmission. There is some studies that show about that, but we still need a lot of information to know about it. Okay, you can have different presentation in different hairs, going from subclinical presentation to endemic and clinical problem. Okay, and usually what I tell the people, if you have mycoplasma in your calf, you might have mycoplasma, for a long time or probably forever. Okay, you need to marry mycoplasma sometimes and deal with it. Okay, so
Dr. Rodriguez,
yes, sir.
can we stop here
Of course.
or you want to
Yeah.
finish with that? So I have a question in the chat. And can you talk more about the identification of Mycoplasma bovis? And there is a specific question that it says, which test you recommend to identify Mycoplasma bovis?
Okay, I'm gonna talk a little bit about that here. You can do different stuff. I definitely transtracheal wash and necropsy to me is the best, right? Send it to the lab, talk to the lab first so you know what is the way that you need to send the samples and send those samples. Those are the best ones. Okay. You can do some surveillance. I'm gonna add here. Okay. Even if I don't like nasal swab too much from different disease, if you're gonna use nasal swab or deep nasal swabs, okay, you might find some bugs around. You might find Mannheimia, Pastorella. They are common. They are normal flora of that. Now, mycoplasma is not really part of the normal respiratory flora. So if you want to just do a surveillance and look about that, you can actually swab and take a look what you find there. Okay. Now, be careful. If you have positive samples, that doesn't mean that mycoplasma is creating the problem or is creating the problem that you have in the pneumonia or whatever problem you are having. But you need to be aware that mycoplasma is around and it can be creating some situations over there. So that question was timely done. So this is what I would recommend if you want to check. But the definitive one is necropsis, send lungs tissues so they can, culture that. That's basically what it will give you information. And if you do transtracheal watch, you can also send some fluids and culture that. Okay, look at this. This is a panel of the nasal swabs. And you can see, of course, you see some coronavirus. You see over here Pasteurella. You see, Mycoplasma also around there. Okay, you might see animals that are pretty normal, and you're gonna find some of them are normal flora in the upper respiratory tract, and Mycoplasma is not. So if you have it around there, be careful because it might be part of the situation. Okay. Let me talk into the prevention a little bit, and we stop again for more of the chat.
Dr. Rodriguez, another
Yes, sir.
question related to
Okay,
that, to the
sure.
same topic. You mentioned about the necropsis, but sometimes those chronic calves that we submit for necropsis, they are being treated with everything.
Uh-huh.
And sometimes, unfortunately, we don't find the mycoplasma in there. Can you
Yeah,
comment a little bit about that?
yeah. If you're that's a problem that I see in the field a lot, right? The other day I was in a calf operation and they say, hey, we're not going to treat with this antibiotic on this antibiotic because we have a lot of resistance, right? You say, okay, what sample did you send? Well, I sent this sample that was a chronic. How many times has been treating? 8 times. So what do you expect if you send an animal chronic that has been treating 8 times for different antibiotics? You will expect to have a lot of resistance, right? So again, you might find if you are in an outbreak, or you having some problem and you find some animals that are not treated, that is the best time to do it, right? As I told you in the slides before, if you are doing transtracheal wash, you can take actually a normal animal without clinical signs and find if something is a problem. You can also have animals that are sick and take a look at that. I will say if you have a chronic animal that have been treated for many times, you know, I have never seen a chronic cough coming negative for everything, but I wouldn't trust much. Try to do different necropsy or try to submit different samples, right? So what I did in one of my operations, I used to submit two animals, and I did in 1 week, then 2 weeks after another two, and another two, so I can confirm the diagnosis. Okay, and run virus, run bacteria. You can run also salmonella. There are some cases on salmonella doubles that it can have also respiratory signs or pneumonia. Okay, it's important that you have a lab that you work with them. Okay, all
Correct.
right. Okay, I'm going for prevention, and we should have like 10 minutes more of my presentation. So I think we're in good in time. Okay, be careful of the waste milk. Okay, if you have an operation that is basically giving hospital milk to the animals, it might be a risk. Okay, there are some information that basically if you have increased bacterial count, you will have more problem, and that's not a secret for anybody, right? We have been talking, and I praise the Dairy Calf and Heifer Association because um, this information about management, about colostrum, about cleanliness, about the consistency, and about ventilation is important. We keep talking about that over and over again, and we go to some operations and some basic stuff on colostrum management, refrigerator, administration. We still see a lot of opportunity. We test total zero proteins and they are low. So do not forget about all those management stuff, okay, that we need to do. You need to eliminate the mycoplasma from the cow hair, right? If you have cows with mycoplasma, usually most of the people eliminate those cows, okay? And you can also, pasteurize or feed milk replacer. Again, it has to be tailored of the necessities of your operation, okay? Ventilation, group houses, those are factors that we need to look for, okay? If the animals are housed with close to sick animals, I want to make a comment here, and be careful with BBD also. I have seen a lot of BBD cases recently. I don't know really what is the reason. I don't know if we are, forgetting a little bit about the importance of vaccine management and vaccination and time for those vaccination. I have seen a lot of problems recently with BBD. So if you have PI animals around these animals that are gonna decrease the immunity, that's gonna also potentiate the rest of the box, and Mycoplasma will definitely take advantage of that. Okay. Cleanless, if you have animals that are housed in some stalls that they were dirty, clean it, disinfecting, that's important. Okay. So different pictures where it was one of the questions where we can see Mycoplasma here in those winning pen with those animals are together. They are commingled over there and they start getting around, fighting for the food, fighting for the water. Some of them eat more, some of them eat less. This is a place where you need to be looking for if you have some problem over there. Okay. So clinical again. I'm going to give you two slides about immunology. I cannot let this opportunity go, right? So you know a little bit why is the response that we need to try to control the mycoplasma, okay? If we have the macrophages, right, and the T cells, meaning cellular immunity, it has proved to be a better response to control mycoplasma than the humoral immunity, okay? Different research about that. Reach out to me. I'll send it to you. Okay. Neutrophil, that is usually one of the first response, but it's not terrible effective, as I say there in the slide. Okay. When you have the recruitment of the neutrophils, the problem can be actually worse and worse. And one of my answers to your question was, what happened? Why do we have so many problems treating those animals? Because this is part of what the mycoplasma does. Mycoplasma is able to manipulate, if we can say that word, the immune system. Okay? So a lot of people ask me about colostrum. It has not been a really strong evidence that the colostrum or the antibody titers have a protective or very good, effect on controlling mycoplasma. So don't throw that colostrum on the mycoplasma standpoint. However, this is one or probably the most important, times that you need to take care of your calf. Day one is the most important day. Give it the right amount of colostrum, clean, and it has to be of that good quality. Okay. One about the vaccination. There is a couple research, basically showing that the live vaccines can protect about the clinical challenge for the mycoplasma. And if we are able, right, to suppress the humoral immunity path and increase the cellular immunity path, that will give us a chance to protect better against the mycoplasma virus. Okay, so this is the vaccine. I'm going to stop here because I just have 5 more slides before going, okay? And I'm going to talk a little bit about some cases and experiences using Protivity that is a live vaccine. It's basically the only live vaccine that we have right now in the market to control mycoplasma, okay? So many people talk about Mycoplasma bovis and some bacterians or some autogenous vaccine, okay? Some studies have shown that they have limited efficacy, okay? And basically, they will not stimulate a strong cell response. They will go a little bit more on the humoral response. And that is the key, the main difference that we have right now between the live vaccine and the traditional vaccine that we have used in the field, okay? So, Gustavo.
Dr. Rodriguez, before
Yeah.
you go there, just let
Yes.
me a couple comments that I have here in the chat and also a couple questions. So, what is something to not overlook when preventing Mycoplasma bovis?
Okay. The first, management. Do not overlook the importance of a good maternity, a good colostrum, a good nutrition, a good cleanliness, and a good ventilation. If you are not able to work on that and to control a lot of those factors, you don't have to make it perfect because it's very difficult. If you don't have those management well controlled or working on that, That's gonna be. It doesn't matter what you put over there. It doesn't matter if you put the best antibiotic. It doesn't matter if you put the best vaccine like Protivity. It doesn't matter. It will never won't work. The second that I will say, do not overlook again the subclinical part of Mycoplasma. Mycoplasma might be having some subclinical effect, decreasing the immunity of the animals, and you might not even see it, right? Like the example that I show you, oh, it's salmonella, or it's just the ear infection, or it's another thing. Be careful. Do not overlook that, okay? So that's the importance. And again, the third that I always say, work on a population immunity, okay? Work the management on the population. Try to decrease the challenge that those animals may have to the mycoplasma. I think the vaccine is great because it's start controlling that in time. And do not overlook that you need to work on population. Do not believe that if you're going to put this vaccine, all your problems are going to be done and you're not going to have pneumonia. I have seen people, hey, I have tried the vaccine for 2 months, but still we have a pneumonia problem. So what do you expect? Okay, pneumonia is a bigger problem than just mycoplasma. Mycoplasma is going to help you on that. And if you think that you're going to control mycoplasma again in 2-3 months, you are absolutely wrong because it won't happen. It's very difficult pathogen.
And it's just a reminder to our managers and to our owners of the operations. I think it's really important to keep good records of the BRD and treatments, so that way we can relate those diagnoses that we'll be doing with what's happened in the farm, recording on those treatments.
Excellent point, Gustavo. Excellent point. If you don't measure, you can know what is going on around. Okay, so always, animals that have pneumonia, diarrhea, animals that are sold that die, that's important for them. Okay, perfect.
Excellent.
Anything else, or can I go forward?
Go forward.
Okay, I have like probably 3-4 minutes more. Let me give you this experience. This is a trial that the one calf ranch in California was interested in using the vaccine. And we basically took advantage to do some safety information over there also on the vaccine. And they wanted to see, right, if the vaccine was going to be good, to implement in their program. Okay, so they were not having clinical. I mean, they were not saying, "Hey, we have a lot of clinical problem" or anything else. They would just want to see if that happened. They knew that they have in kind of a degree mycoplasma. And again, everything. It's a calf ranch. They receive animal from different facilities. Okay, so there were 600 animal per group, treated, not treated, meaning vaccinated and not vaccinated. And they basically look at this, and they saw a reduction of mortality in a difference of around 4%. Okay, so what they wanted to know at that time, and that was in 2022, if that was the return on investment of this product was going to be good for them. Of course, at that time they
Dr. Rodriguez, we're having
it's
some issues
around
with your internet.
$1,000 or more. So that was something that they were interested to look for, and the return on investment at that time it was up to $6 to one, depending of the price that you put to the animals. Okay, but something that I want to show you here, guys. The animals were moved to the weaning pen around 30 days. Look how both of the groups basically separated from each other, right? They have more mortality in those animals that were not vaccinated, but the big effect of this
Could you
animal, and
describe the
we have,
lines, Dr.
huh?
Rodriguez? Could you describe the lines? Could you tell us
Sure.
what we look in the graphic?
So this is death, okay? Accumulated death by day, okay? So this basically cumulative death by day. So this red one was this animal vaccinated, or the group vaccinated with um,
Protivity.
Protivity, okay? And then the animals that were not vaccinated with Protivity, okay? So that was interesting, right? Group 1 and group 2. And basically, when they went to the weaning pens, those animals that were vaccinated had less mortality than the ones that were not vaccinated. Okay. Now, I'm going to cautious about this. I have heard a lot of people, hey, I want to try this vaccine or that vaccine in my operation. I'm not a big fan of that. I have even heard some people, consultants, say, well, get the vaccine and, try it just to see how that goes. Every time that we have a request about this, hey, let's do this field trial, I really don't like it. I really don't like it because you are not challenging the animals. It's just natural research over there. So take from this research and the information what is worth. Okay. Do not think that this is a full, control challenge trial. Okay, we are not challenging this animal at any point. It's basically the natural infection and the natural dynamic that is over there. Okay, I had a consultant telling me, hey, Dr. Rodriguez, I want to try this in the operation. And this is what he did. He put the cross beef animals in one group and the dairy heifer in another group. So from the beginning, that trial was already biased, right? And he told me in 2 or 3 months, well, we didn't see a lot of difference, right? It's a very, very well managed, well colostrum management. And I said, well, what were you expecting, right? Actually, what kind of bias? I was happy that the hosting was able to perform at the same level as the beef. Okay, but be careful with those trials if you're attempting to do that in your operation. I am not a big fan. It has to be very well monitored. Okay. Another one, this is one of my dairies that I help over here. And as I tell the people, when this vaccine came, I thought and I say, okay, I'm going to make this vaccine fail and I'm going to put it in this operation. Okay. We started giving the productivity with different management strategies. Okay, we did some, of course, assessment on the maternity, on the colostrum. We saw the pasteurization process. We saw, the cleanliness. We saw the ventilation, the flushing. We measured different points like ammonia. Anyway, we work, as I told you before, a comprehensive program on that. And we also included the vaccine. The vaccine was included around summer of 2022. They were having different problems. Okay. And this particular graph up there is total mortality. Okay. This is mortality for everything. Okay. So one of the effect that I see on when you start getting the vaccination, again, I have no proof for that, right? But I believe that the vaccine is able to control that subclinical part of the mycoplasma and help the animals to get a better health, a better immunity, okay, and perform better. Okay, so this is overall mortality. It has been decreasing, from that time that we started. I started seeing more of the effect around 6 months, but after a year, I say, wow, this is getting really good. The manager say, man, I don't see any of those signs of the early calf with mortality, with pneumonia. So that was a great experience to me when this vaccine came. This is basically the mortality just for pneumonia events. Okay, you can see from, they were around 23%. They have been going down. This facility keep having some challenge on the flushing, on ventilation, on salmonella here and there. But it has been a great experience on how management, people, different strategies, antibiotics, control with antibiotics and the live vaccines also over there. Okay, so almost to be done here. Another dairy where they had that problem. The reduction in pre-weaning mortality came from 19 to 5. Again, it was a population approach. The treatment had been reduced as well. Okay. Give it with the AABP. I need to, praise my association. We recently had the conference. Okay. Vaccination is just one aspect of the disease prevention. Okay. If you don't have management, nutrition, and husbandry practices, you are done. So have the real expectation for that. Okay. There are many discussion points that we're having right now that we're getting more information. What about what antibiotic to use on the vaccination? Because it's a live vaccine. That's another topic. Reach out to me if you have questions. Okay. I will say something. If you're giving the vaccine, and you have a sick calf, treat that animal with a good antibiotic. Okay. And work on population immunity. Okay, it can be done. It's easily done. I think that we as Zoetis and many people have took so much onto that to not use antibiotics, but it can be done. Okay, some people are asking if we can apply a third dose. We have seen some research on increase of immunity on the titers with a third dose. Okay, when do I see the results? Create real expectation on your programs. Do not think that you're gonna solve a problem in 2 months. If you have a mycoplasma clinical problem endemic, it needs time. Do not think that you're gonna add a vaccine and you're gonna solve all the problems. You need to do some management, okay? And also, you need to work with the people because sometimes the people is resistant to change, and this come with the topic with the antibiotics, okay? So here it is. These are my key message. Okay. Remember, you might have mycoplasma and you don't have, sometimes you don't think on that the first time. Be careful of the subclinical effect. Okay. Use a population, a comprehensive approach to mycoplasma. And remember that we now have this tool of a live vaccine. Okay. Back to the post. I'm open to any question, comments. Thank you, Gustavo, and thank you to the Dairy Calf and Heifer Association. It really excites me to talk about mycoplasma. I appreciate the invitation.
Thank you, Dr. Rodriguez. It was a really light presentation. We have a couple more minutes for questions. Um, we are almost in the top of the hour. Just another reminder that we have a Spanish CAF chat on Thursday, October 16, around 12 p.m. Central Time. So I'm just letting the audience reach the chat and do some more comments, Dr. Rodriguez. But in the meantime, I have a question.
Yes, sir.
So once I have mycoplasma in my herd, how long that mycoplasma will live?
Well, if you have the mycoplasma around your hair in the young calf, again, as I say, you probably want to marry mycoplasma because it's very difficult to get rid of it. Okay, mycoplasma will be in the environment. It can last from weeks to actually months, right? Depending on the different conditions, humidity, ventilation, exposure or not to sunlight, etc., right? If you have animals that are carrying mycoplasma around, not necessarily in the milk, but they are carrying in the nose or the vagina. If you have different stuff, you will expect the mycoplasma come here and there. If your immunity of your animals are good, you have very good, nutrition and management, you might be able, to control mycoplasma, and you don't see many of the clinical signs. But be aware that the subclinical part of the mycoplasma might always be around there. Okay.
Excellent. Thank you. Thank you. So we're waiting for another comment. We have a couple more minutes before we finish our chat. So if there is any other comment, please use the comment chat and I will refer that to Dr. Rodriguez.
Yeah, and another stuff, Gustavo, anybody, if you want to reach out to me or Dr. Pena, that's the email, okay? Send us an email, send us a comment or a question that you may have. If you want to implement a program and you want to talk about, hey, how do you manage the vaccine and the antibiotic? Hey, what can I do here? How can I monitor? What test would you recommend to go? Don't be shy. Send an email and reach out to us, and we will be happy to help. Okay.
Once again, thank you, Dr. Rodriguez. It seems like there is no more comments or questions in our chat. So I will thank you for the fantastic presentation. I will thank you to the Dairy Calf and Heifer Association for this invitation, for allowing us to present. And also I want to thank all the people that join us in this CAF chat today. I believe this CAF chat is going to be posted on the Dairy Calf and Heifer Association YouTube page and also in our Zoetis Facebook page. At the beginning, our goal was to make you feel more comfortable when discussing mycoplasma and finding mycoplasma in your farm. I think, or I believe that we accomplished that through this CAF chat. I appreciate your help, Dr. Rodriguez. And if there is no any more questions or any more comments on your side, I will be closing this chat. Thank you, everybody, for joining us today.
Thank you. Take care, everyone, and thank you for the opportunity. See you on Thursday, okay? On
See you,
Spanish.
see you
See
on
you
Thursday in
Thursday in
Spanish.
Spanish.